to state this as a community goal, how would it say?
Lack of, employment skills training available. Something, because that's something the community could provide, would be training of employment skills.
Okay, if it were a community, could you say our community lacks training opportunities for employment. Okay. Okay, now how would we state it if it were a family goal? Because we said it could be either one. So how would we state it if it were a family goal? What are we talking about? Employment skills. Okay.
I'm thinking more along the lines of the family taking a proactive role in seeking out skills.
So how would you say that individuals lack employment skills?
And job training.
Okay, individuals. So if we put in individuals here lack employment skills, let's just put individuals lack employment skills. Okay, and that then would clarify it enough to make it a family goal.
Right.
That would be a family goal. Okay, and then our next one, what goal is this? Families are able to find housing in safe communities. That's a
It depends on how you word it.
Depends on how it's worded.
Families.
Right.
okay.
It's throwing the responsibility on the family to find it.
Okay, so in this instance, this is a family goal. Okay,
Right.
in this now what about community lacks jobs? Okay, that's a community goal. Okay, and the community gives excessive tickets. so that's
a neighborhood.
But the neighborhood is a community though.
That's an individual.
all right. So let's just ask the question about this. What type of tickets are we getting? What makes we need to make this more specific if we're going to work on it. Remember.
For what?
Yeah,
Anything. Are they speeding tickets or? I live in a community where at the end of the month, you have to be careful because it's been told that the police department give out excessive tickets because they have to. They have to meet their quotas, yeah. They have to meet their quotas. And I'm just telling you, even on Facebook, you know, it's a community. My job is to live in my quota, be careful. So it's just get ridiculous, something needs to be done about it. And that's a problem in the community. So that's why that's how I feel. So I think individuals are.
Okay, so since it's tickets that deal with a variety of things, let's see, we got to word this because what I want you to think about when you're doing this is that once you have your goals, then you have to think of strategies and all as to how you're going to make it better, make a change.
Well, I talked to Mr. Tarver about it one time already, and he made a suggestion. So that's how as community as a whole, how can we make it better?
Okay, so if we were to, is there a way to reword this?
The problem is that if they are getting excessive tickets, that means that that's affecting their finances, right?
Yes.
So
Fayetteville redid their courthouse
because of excessive tickets.
Low income.
Okay, all right. So now we can deal with that. Okay, let's say low income families, finances or being affected because of excessive tickets.
Right.
Okay, let's say that. Yeah, and low income families, income is being affected because of excessive, because of and we'll scratch that out. Excessive tickets.
Yes.
Okay, and so when we write it that way, what goal does that make? This then becomes a what? A family goal. Okay, all right, and then we have the next one.
Community
Quality and affordable child care. Okay, and that's a what? That's community goal. And then our last one then is what?
Families like transportation to work.
Okay.
It becomes both. Even though it's stated as family, it really is a both issue because the city or the local government would have to assist some way in getting transportation.
Okay, but
Which is what I think she was alluding to, and then she was talking about the families that don't have their own transportation, but were you talking about the community actually providing transportation? That transportation is not out there and it's not available. So stated, it could be both ways, but that one particularly
Specifically goes to families only.
Family.
Mhm.
Because she's talking about families don't have their own transportation. But if you stated it a different way.
yeah, you could state it a different way.
A lack of transportation offered in the community.
The community.
Public transportation.
Okay, the community lacks public transportation. We could put that as one.
Well,
Okay.
the housing one too, I was really thinking about that as a community issue because a lot of families, when they apply for government housing, the waiting list is so long and there's really a lack of availability. And it's caused them to live in unsafe areas for long periods of time before waiting for housing to come up.
Okay. All right, so as you see, we have there are a lot of things in your community that you're dealing with, that you have. But what we have to do is remember that we're looking at what our mission is, and we're also looking at what our problems are. Now, what I want to do now, let's look and see which one of these end up having the most. Okay, let's just.
Families lack transportation to work and children going at home.
Okay, so this would be, there's two here, there's two here. So let's make this is one, let's start that one as one, okay? And then we had children going to bed hungry, we had two of those. Okay, and then our next one, because we had a lot of conversation around housing. So we will make that the third one. So if we were prioritizing and trying to decide what it is that we're going to work on as an agency, then we would put what we have said here, put it down, and then we'll look at the one that ended up having the most conversation about. And in this case, we had lack of transportation for getting to work. We had children going to bed hungry, and we also had the one on housing. The one on housing. So we would put that down. We need to put those down as our priorities. Let's see. Our number one priority would be both of these here too, so we just go lack of transportation, okay? And all right. Now, what we have just done, we have just completed a consensus priority of needs assessment. You know, because you work in the community and all, you are the expert. You're the one who has the information. You're going to put, okay, we got to put all three of these. I'm sorry. We're going to put our three. Okay. Now, number one, our number two, okay, and our number three. Yeah, okay. All right. Okay, and because you are experts and you've given your opinion, because you're out there, you know what is going on in the community, then together we have just conducted a key informant survey. That's what we've just done. We've done a key informant survey, and we have prioritized our priority consensus, and that just means that we ranked our needs in order of what we considered was priority. Okay. Now on our logic model, what we've done here now, we have found out about our needs. And needs actually go in our first column on our logic model. So that's the first thing that you do when you're looking at your logic model. Okay. While this is one kind of an assessment, it is not appropriate to only consider the experts and what the experts have to say. When we turn, when we're looking at what Drucker says, we also have to consider who are our customers and what do they value. And what we'll do now is take a break and give you an opportunity, and when we come back, we'll be talking about who are our customers and what do they value. All right?
Okay.
All right, now we have to consider the other questions of Drucker's questions. Number who are our customers and what does our customers value? Now, we need to remember that we have two types of customers. We have our primary customers, and those are and please look with me on page 25. We're looking at who our customers are. The primary customers, who are the recipients of the services, whose lives will be impacted by direct participation. Those are our primary customers. But we also have the supporting customers, and those are those could be our funders, our policymakers, our family members, partners, others who have input into the service. Now, both of these customers must be assessed. When you're doing your assessment of your community and your customers, you need to assess these customers also. Drucker also cautions that customers are not stagnant. They're not going to be the same people all the time. Every time you change, they're going to change. Customers change. So the organization that is devoted to results will adapt and change as they do. So you have to remember that just because you did that yesterday with those people, you might not be able to do that tomorrow with those people because customers change. Okay? And we also, another important thing is that we find out what our customers value. The question, what do customers value? What satisfy their needs, wants, and aspirations? It's not complicated. Nonprofit leaders tend to be convinced that they are doing the right thing and are committed to their cause, that they come to see the institution as the end in itself, rather than asking, does it deliver value to our customers? So begin with the assumption that what you believe your customers value, then you can compare their beliefs and with what customers actually are saying and find the difference and go on to assess the results. So what we're saying with that is, you look at, just like we did our informant survey over there, we have found out what we were thinking. Now we go to our customers. We find out what they are thinking. And then from that, we find out what we really need to be doing. as an agency. And then, when we collect our data, because one of the things we're doing, we're collecting data. And once we find out what data that we have to know that there are two kinds of data also. And we have quantitative data and we have qualitative data. And I'm on page 26 now in your manual. Now, qualitative data is primarily used when you want to find the depth and breadth of an issue. It provides you with opinions, observations, and other rich, subtle information that you can you can't get any other way. Now, one thing, when you look at qualitative data, it has an L in it, so you that'll help you remember that those are letters. That deals with words and all. When you're just trying to remember what are those two types of data. And then the other one is quantitative data, and quantitative data provides information in specific categories, such as collected in client characteristics. This is often referred to as like demographics. When you look at your demographics, those are quantitative data that you are collecting there. So when we look at qualitative data, we often think of that as the primary data that you are collecting, and then you have your quantitative data. Now, the other important thing when you're looking at your community is not only to decide what your customers want, what you think what your customers want, and you also need to think of the resources that you have available to you in your community. And how would you discover the resources that you have available? What do we look for when we're thinking about the resources that we have in our community available to us? When you think about maybe the jobs, you hear about the jobs that are coming into the community, you hear about the other programs that are being set up in the community. And the thing that we have to look at is not looking at these things like other agencies that are opening or other agencies that are doing the same services that you are doing. You don't want to think of them as threats to you, but you think of them as opportunities, because that might be an opportunity for you to collaborate with another agency. They might be doing some of the same things. They might be lacking some of the information that you have. And if you collaborate, then you're able to give your clients more, and they're able to give their clients more. Once you have gathered all of this data about the community needs and the resources, what do you do with it? Before you begin to make your agency plan, you must find a way to organize the information you have collected and make some sense of it. And that's when you come down to analyzing, because raw data is not information. It has to be analyzed before it can be useful. Now, if you look on page 28, you have at the bottom there certain questions. Here are some questions to ask to help organize the information. We're not going to go over those, but I do want you to read them and use them when you're thinking about how to organize the data that you have collected. Now, there are certain tools that you use for analyzing, and when you look on page 29, you would have there certain techniques of doing it, and I'm not going to go into depth about these, but you have the identity root cause, or the 5 whys. You have the force field analysis that you could use. You have comparison techniques. You have the cause and effect. You can look at your data and say the cause of it and what effect it had on it, or the trend analysis. And those are all types of ways that you can look at the data that you have received from your community assessment. Now that we have identified some community needs and resources, it is time for us to consider what the agency will do to respond. And you're going to be turning to page 31, and developing result-oriented plans, part 1. And I just want to go over our key points from this segment. This module stressed the importance of connecting the community needs assessment process to the establishment of agency outcomes and the agency mission. We introduced the needs assessment process that can be accomplished in a training and can also be taken back by participants to do in their own CAAs. Recognize the key informant approach, where everyone in the room is an expert in something in the CAA or in its community. Stresses that it is necessary to tag each problem, need, or situation by family, agency, or community, and proper identification of the problem set the path for the solution, whether in the agency or elsewhere in the community. We talked of Drucker's question 2 and 3, added a dimension to the needs assessment process, finding out who the customer is and what the customer value adds weight to the key informant assessment. Introduced some important concepts about gathering data for decision making in the agency and identified data that can be used. We introduced the concept that data must be analyzed before it becomes useful in planning for agency response. And we identified some of the logic model in the needs assessment information where it would be on our logic model in the first column. Okay.
I'm doing module 3, developing results-oriented plan. I'm identifying outcomes. Our learning objective will participant will understand that a community action agency plans for outcomes. Okay, we're gonna cover in this thing our needs, and we're gonna come up with an outcome in our community assessment based on what the agency will be seeking to accomplish. I want everyone to turn to page 32, why plan? Use that page to identify an outcome on why planning. Can you tell me some reason why an agency needs to plan? What was my stride? You can just call out some reasons why.
They have to have a vision.
Have to have a vision.
Mm-hmm.
And other, why we should plan?
You know where you're going.
Yeah, know where you're going with vision.
You can't determine whether you've been successful if you didn't have a plan.
Okay.
How it applies to the overall mission of the.
How it applies to your overall vision, your overall mission of the program? Okay. Huh?
No, I was saying time.
Time.
Yeah, keep time.
Keep up time on how long it's gonna take. It's keep up time for each initiative or project.
It lets you like allocate your resources better.
Yeah. Better ways to allocate resources. one of the things I identified earlier, and it sounds like some of the stuff some of you might have said, it helps you identify where you want to be in 3 to 5 years. It allows you to remain competitive as needs and community environment change. It will help you identify agency staff and the board members around a common vision and common outcomes and goals. So planning is very good. I mean, very good thing to have. And actually, what should come first? So turn to page 33. You see the cartoon? While it might be humorous, it would be easy to recognize that most participants, you might get the grant and then try to figure out what you do with that money. And as we heard earlier, we talked about what happens without a plan, and if you have a plan and if you're not following the plan, then you have mission drift. So you kind of drift off what your plans are. So Drucker says never subordinate your mission in order to get money. And we're going to follow that with Drucker 4 to help us to look more in depth at the results. On page 34, what are our results? And we're going to visit with Drucker's question 4. What have been our results? And we're going to go on page 34 and read what's underlined and what's in bold. He said that we should look at both short-term accomplishment and long-term change. According to Drucker, in business, you can debate whether profit is really an adequate measuring stick, but without it, there's no business in the long term. In the social sector, no universal standard exists for success. Each organization must identify outcome and honestly judge where lives are being changed. And what we want to do is look at how lives are being changed. Have we been successful? In the last module, Ms. Audrey talked about qualitative and quantitative data. And it's important what Drucker says about quantitative and qualitative data. And she said qualitative results are more intangible and therefore harder to measure, but are still very important. Improved self-esteem, empowerment, or motivation may be considered qualitative improvement. Quality of life is sometimes included as an outcome for some program. Now, quantitative results are the counts of individuals who met an outcome that is defined by standards such as a secure job, kept for 90 days, or the improve income by a projected amount. We'll come back to Drucker and discuss qualitative and quantitative measure in Module 5 in greater depth. We'll talk about strengthening and abandonment. If you turn to page 35 in your participant manual, strengthening and abandonment services are based on the quality of results being produced. You will return to this. This idea in the next module, but we're discussing some of the strategies. Okay. Benita, would you do me a favor?
Which one?
Would you read right below, some things must be abandoned?
On 35?
On 35.
To believe that whatever we do is a moral cause and should be pursued, whether there is success or not, is a perennial temptation for nonprofit executives and even more for their boards. Everything is a good cause, but we cannot afford to continue where we seem unable to further the mission.
Thank you. Do we produce results that are significantly outstanding or for us justify putting our resources in another area. Derek, could you read that right below that?
Need alone does not justify continuing, nor does tradition. People in any organization are attached to the obsolete, the things that should have worked but did not, the things that once were productive and no longer are.
Thank you. Y'all were, when you work in a community action agency, sometimes you see things, this is the way we used to do it, this is what we always done. You always have these traditional things that times have changed. And you have to always go back and re-examine the needs of the community, the outcomes, and the changes that happens within that community. However, the agencies must be careful to distinguish between programs and services that are not productive and that no longer are a part of the agency range of services, and those services that are essential but currently not producing outstanding results. With some of our programs, well, say for instance, Life, it's productive, but we don't have a lot of, the funding and some other stuff, but these are some that you wouldn't want to abandon, you want to strengthen. But we also have programs within our agencies that we've kept for a long time and no longer need them, and sometimes we need to abandon those. And then the end results of what Druckers is saying, what results does the agency want to achieve? Turn with me to 36. Results or outcome changes. And we use the word results and the word outcomes interchangeably as we move through the various principles. Simply put, outcomes are results or changes observed or reported after participation in activity, in service or activity. Right below that, Kim, would you read what's starting for family, for the family?
For the family, outcomes or changes in knowledge, attitude, skill or ability, or behavior. For the agency and community, outcomes may be such things as changes in agency or public policy, organizational effectiveness, or social and health conditions.
Thank you. CAAs and CSBG eligible entities, whether private, nonprofit, community-based organizations, or agencies in local government who provide direct services and or use subcontractors, produce outcomes for individuals, families, and their communities, and the agencies itself. Types of outcome. Outcome may happen over time and represent change in the situation, status, and the change of direction for family, agency, and community. Could somebody read the change over time for me?
Consider the difference in time frames in different situations. Short term for a client and need of shelter may be this afternoon, while short term for someone obtaining basic job skill training may be 6 months. You will identify the change to be observed in a time frame that matches the situation. This may be characterized as short term, intermediate term, or long term.
When we start looking at the logic model later on, you're going to see these changes, short term, long term, and intermediate. When you start making those adjustments, as a little farther on, and that's probably module 7. Changing status. Get someone to read that for me. Let's talk.
Situations may be identified at different levels of status. Residents of one public housing project may feel they are safe, while those in another project may feel they are in crisis. Depending on the location, neighbors, and other environmental factors, some housing situations can be considered priority.
Yeah, we'll be in module 6. We'll be looking at those situations and status and some of those things. And change the direction, Mr. Tom.
The positive outcome indicate. Did you say that?
That's right. You fine. Yeah.
A positive outcome indicate process towards a goal. A neutral outcome may indicate stability or no change in status. A negative outcome may indicate that the situation has changed for the worse.
Okay. Very good. So when we're looking at families and needs, we always got to consider those 3 things. what's changed over time, what's changed in status, and what's changed in direction, similarly for an agency, for a community, for individuals, and for families. If you look at on page 37, examples of family outcomes, low-income people become more self-sufficient. Self-sufficiency is more than employment and employment-related activity. It can also include outcomes from support activities necessary for movement towards self-sufficiency and a reduction and elimination of barriers preventing self-sufficiency. And look at some of the bullets. Could you read a couple bullets from Benita?
Unemployment persons obtain employment or self-employment. Employed persons obtain better employment or self-employment. Persons maintain employment for at least 90 days.
Thanks. That's very good. Low-income people, especially vulnerable populations, achieve their potential by strengthening families and other supportive systems. That's goal 6. Actually, that was goal 1 you read, Benita. That was the goal. 6 national goals. The first one that you read was goal 1, and the one I just read was goal 6. When we started off with the 6 national goals. We talked about that in the timeline. There's a broad range of outcomes that are achieved by persons or families who maintain a level of stability or well-being as a result of a community action. Could someone read a few of those bullets for me? Indeed.
Persons increase education or skills. Persons increase family function skills. Persons increase ability to manage income. Persons obtain, maintain, or improve housing arrangements.
Okay. Now, it's important that you know how this works. It's not like a need, but they're outcomes. And these are outcomes of what a person increase. And when we address that later on, the needs, we want to put that in the outcome. You stressed what a need was earlier, so now we're going to get to what an outcome is a little bit later. You go turn to page 38. Agency outcomes. Partnership among supporters and providers of service of low-income people are achieved as goal 4. And agency increase their capacity to achieve results, goal 5. Someone read the little letter up on below goal 4, the shaded area.
It is not the existence or counting of partnerships and collaborations, but the impact these arrangements have on clients and their communities.
Yes, agency formed to maintain partnership and collaboration to coordinate service delivery, improve program efficiency, streamline administration, and or eliminate the duplications of services. Agency form and maintain partnership or collaboration to improve community planning. Agency form and maintain partnership collaborations to achieve specific outcomes. Under goal 5, so I'll read that. The shaded area.
Agencies that are well run and meet accepted standards of excellence demonstrate continuous improvement and capacity to meet the needs of low-income individuals, families, and communities.
Okay. Our agency leverage external resources, including in-kind and donated items, to increase the capacity to serve low-income people. And everyone in Head Start, we know we live and die by that. Agency maintain sufficient discretionary funding to support unexpected negative cash flow. And that's what we do at CSBG and some of the other things. Agency increase ability to document clients' achievements and outcomes. And agency improve implementation of the full range of enrollment activities, according to IM 49. Okay. See, I think we're gonna do an activity now. Oh, no, we gotta do 2 more goals. Goals 2 and 3. I forgot to mention that 1 and 6 goes together. 2 and 3 goes together, and 4 and 5 goes together. So example for community outcome. The condition in which low-income people live and improve in goal 2. Cause I guess you wanted that shaded area.
Community outcomes are an integral part of community action and describe the allocation and focusing of public and private resources for anti-poverty purposes, improvement in community infrastructure and creation of employment and other resources to support low-income people in their transition towards self-sufficiency.
Low-income people have improved access to employment, housing, capital, and essential services. While we're doing this, you remember when we were doing the previous needs? And see now, from those needs, at the end of this, we're going to do activity that's going to address that in the outcome. Okay. Low-income people own a stake in that community. Could someone read go through it in the shaded area?
Community outcomes describe the participation of low-income people in community organizations and community activities, including volunteer and paid involvement. It includes business and home ownership, indicators of positive community change and stability.
The number of low-income persons who participate in formal community organizations, government offices, community boards, or councils that provide input in decision-making are reflected in the needs of low-income persons as it increase or maintain. Policy. We're going to do an activity. What are our outcomes? You turn to page 41. What are our outcomes? Okay. Outcomes. Okay. We're going to write an outcome. I'm going to ask you to consider identify needs we did earlier. What would be the outcome for the agency? The family lacks transportation to work. What would be an outcome? The agency outcome.
Maybe find out what is available, what kind of transportation is available.
But what's changed?
People getting to work,
People
on
going to.
time, not losing their jobs.
But is that a strategy or an outcome?
The outcome is they're not losing their job.
Well, but we're talking about the transportation.
Oh,
He's talking about what she said, she said that agencies would find out what was available.
Yeah.
It's surprising what
outcome
is out there that we don't know.
Or is that what has changed?
Or helping to
They just find out
improve,
what's available.
helping to improve public transit in the area, public transit availability.
Yeah, identify, folks that provide transit, like Lee Cott, that drives through Lee County and Macon County. Lee County and Russell County. So what would you say that, how would you say that as an outcome? Increase
increase ridership.
Increase ridership, increase routes.
Right, yeah, I think
Agency
the number of the available buses and stuff.
Or an agency outcome?
Well, agency outcome,
It would increase the awareness of the low-income population that's being served of the service, if the agency isn't directly providing the service.
What was she saying?
the agency would link.
Link them to the service.
Agency provide
Yeah,
passes to public transportation.
That would be good.
okay. Maybe. ABC agency provide.
Well,
Or tickets or whatever.
I think an example would be just the new, medical transportation that just became available in our area. As soon as our agency found out about it, we were sure to get that out to all of our families, you know. We got the brochures and the number, and we were getting it to them because we knew that was a need, so I guess.
That would be.
That would be.
Legislative referral.
Just have to remember
That
what outcomes is what has changed.
What has changed? And provide passes. What else could the agency do besides providing passes?
Referral, I don't know whether that was alluded to, but it's a referral. Better referrals to services.
Better referral, I mean, how would, what?
Well, I know where you're trying to get me, I can't put the word there. Where you trying to get me to go?
What would that change? I mean, like an example, what would change if we said the community need lack of housing? You said, well, new housing for Habitat of Humanity will be put in the community, or that would be a change, or a family need was homes, and you know, individuals might negotiate lower mortgage payment, or just say an individual secure lower cost of living. So right here, you could, I mean, it could be purchasing an automobile.
I think what throws you is that to work, they need transportation to the doctor, for groceries, for all kinds of things. So we're kind of limited by putting to work.
Well, we focused on the to work one because we did just get that new
Yeah, because like
transportation
what we're trying to answer is to need.
And that's what keeps a lot of them from getting jobs, is because they don't have
And
transportation.
most of them have a grocery store close enough to their housing area they can walk to, but they can't get to work. They can't get a job and go.
I mean,
And how come maybe would be if they don't have driver's license to,
Secure.
secure
Secure
driver's license?
yeah, and insurance for the car, because that's another.
Yeah.
Would it be a way that we?
Well, the outcomes, though, we're not just talking about strategies, but the outcome would be, you would just say, well, if they need transportation, a person get a car. The family.
Just say the agency
The
provides
agency
transportation
provide transportation
to work.
to work.
Like if you had van services or something like that,
Yeah.
the agency could just provide transportation.
And-
As long as you can always
that-
flip it.
Yeah, the agency provide transportation. I mean, at one time, we did do that LECOT. I mean, it used to drive from Opelika to Auburn on a regular basis.
So we still, are we just coming up with possibilities of like?
Yeah, you just trying to answer to, yeah, we want to answer to that need, we want the outcome.
So we're not necessarily limited in this, what our agency can
Right.
actually do right now?
No, we're not.
Okay, okay.
No, we're not.
So, I mean, you know, possibly an agency could, you know, try to partner with, the local community, whatever the local transit is, to increase, you know, the number of buses and number of groups.
That's a strategy. The agency, I mean, well, God, we can partner with Auburn University, those buses.
Yeah,
That's true.
Auburn, we need to put in an outcome though.
Yeah.
We need to put it up, but we have buses in Auburn University that we could partner with. How would we-
Agency partners
I have to
with
partner with,
transportation.
transportation
services.
services. And see, that's the same thing.
yeah, that's it.
Because you get self-sufficiency. So
Mhm.
sometimes there's a gap there where somebody may need help, it's not taking over the bounds forever, but they may need that until they can work and afford to get a car.
Well, could we possibly partner with like the different places that they go to work? And see if they might have a solution for picking up people too? That wouldn't be so much on us?
That's kind of the same as.
Yeah, it's
what
kinda
they
the
say,
same.
partnering with people that.
Yeah.
But we gotta-
I mean,
we
everybody.
have to, continue building on the logic model. And that is,
You also encourage like carpooling and things like that, and, you know, networking with friends and. Yeah.
okay.
That was just the
Well,
agency.
That was the agency outcomes. How would we make this?
Establish a network.
Okay, for family, how would we get a family
An outcome.
secure,
Establish a network of.
oh, well, family, we need to have an outcome for the family.
I I think somebody back there said when they say family secures driver's license or, secure,
Or if
but
you're talking,
when you say driver's license. Secure
Driver's license. All
if you're talking about that network, families participate in carpooling network, something like that.
Okay, community.
Yeah, other people in your neighborhood.
So we need a community outcome.
So maybe people, identifying people in your neighborhood that possibly work in that same area, which is a carpool.
Carpooling. Community, provides,
Community
carpool network.
established.
Oh, yeah.
That's good. Community establishes carpooling services.
Okay. Thank you. So we identified agency, family, and community, and we on the logic model as an O. Okay. We will discuss selections of strategies and services in the next segment. In Module 3, our key point summary, identifying outcomes is the first step in strategic planning. Legislative guidance provides the mandate for agency to do good planning, but planning is important because it is the right way to manage an agency. The Drucker Foundation Self-Assessment Workbook offers supporting information that can be used to reinforce the basic foundation of the Roma principle. Outcomes for community actions are on 3 levels: family, agency, and community. There are many different outcomes for each of the 6 national goals. Each domain, such as employment, can be the multiple levels, outcomes for family, agency, and community. Okay. I guess it's lunchtime.